Have you ever heard of acute lymphoblastic leukemia and wondered what it is? Well, let's break it down together. Acute lymphoblastic leukemia, often abbreviated as ALL, is a type of cancer that affects the body's white blood cells. Now you might be wondering, what are white blood cells? Or why are they so important? White blood cells are like the body's soldiers, always ready to defend against harmful invaders like bacteria and viruses. They're an essential part of our immune system, our body's defense mechanism that keeps us healthy. So, when these white blood cells become the target, it's as if our body's defense army is under attack. Now, let's delve a little deeper into acute lymphoblastic leukemia. The word acute means that this disease can progress rapidly, necessitating immediate treatment. Lymphoblastic refers to the specific type of white blood cells, known as lymphocytes, that are affected. Leukemia, on the other hand, refers to the nature of the disease where the body produces an excessive amount of abnormal white blood cells. Acute lymphoblastic leukemia is most commonly diagnosed in children, making it the most prevalent type of childhood cancer. But don't let this fact mislead you. ALL is not exclusive to children. It can develop in adults too, although it's less common. It's important to understand that this disease is not just an overproduction of white blood cells. The real problem lies in the fact that these cells are abnormal. They are immature and unable to perform their normal function of fighting off infections. As a result, they begin to crowd out the healthy cells, leading to a wide variety of health problems. So, to sum it up, acute lymphoblastic leukemia is a complex disease that disrupts the body's immune system by attacking the white blood cells. It's a battle that occurs within the body, threatening our health and well-being. So, in simple terms, acute lymphoblastic leukemia is a battle within your body where your white blood cells are under attack. Now that we know what acute lymphoblastic leukemia is, you might be curious about what causes it. So let's dive in. First and foremost, it's important to note that the exact cause of acute lymphoblastic leukemia, or ALL for short, remains unknown. However, it's broadly agreed upon in the medical community that ALL begins with a mutation in the DNA of a single cell in the bone marrow. This mutation causes the cell to produce abnormal, immature white blood cells, which then multiply rapidly and take over, crowding out healthy cells. That being said, while we don't know the exact cause, there are certain conditions and factors that can increase one's risk of developing ALL. For instance, genetic disorders such as Down syndrome can increase the risk. Exposure to high levels of radiation is another known risk factor. Some studies suggest that certain chemicals may also increase the risk, but the evidence is less clear in this regard. It's also worth noting that ALL is more common in children, particularly those aged between 2 and 5 years old. However, the risk increases again in older adulthood. But it's key to remember that ALL can occur at any age, and these age groups are simply the ones where the disease is most often diagnosed. One common misconception is that ALL is contagious. Let me clear this up. ALL is not contagious. It can't be passed from person to person through contact, coughing, sneezing, or any other means. It's a disease that begins inside the body, at the level of the cells. In concluding this segment, it's important for us to acknowledge that while much about the causes of ALL remains a mystery, understanding the known risk factors can help inform prevention strategies. It's a reminder that even when we can't fully explain why a disease occurs, we can still take steps to protect ourselves and our loved ones. Even though we don't know the exact cause, understanding the risk factors can be a step towards prevention. How would you know if you or someone else has acute lymphoblastic leukemia? This is a question that we must ask ourselves, as awareness can be the first step towards early detection and treatment. Acute lymphoblastic leukemia, or ALL, is a type of cancer that affects the white blood cells. These cells are crucial for fighting infections, so when they're not functioning correctly, it can lead to a variety of symptoms. One of the most common symptoms is fatigue. This isn't just feeling a bit tired after a long day. It's a persistent exhaustion that doesn't go away with rest. It can be so severe that it interferes with daily activities and overall quality of life. Another common symptom is frequent infections. Since ALL affects the immune system, the body is less able to fight off bacteria and viruses. This can result in an increased number of infections, such as sinus infections, bronchitis, or skin infections. Unexplained weight loss is also a symptom of ALL. This isn't weight loss due to dieting or exercise, but rather a sudden drop in weight without any clear reason. If you or someone you know is experiencing these symptoms, it's important to see a healthcare provider for a diagnosis. The process typically involves blood tests and bone marrow tests. Blood tests can show if there are too many immature white blood cells, which can be a sign of all. They can also reveal if there are too few red blood cells or platelets, which can cause symptoms such as fatigue and easy bruising. A bone marrow test, on the other hand, involves taking a small sample of bone marrow, usually from the hip bone, to be examined under a microscope. This can confirm the presence of leukemia cells. Remember, these tests are necessary for a definitive diagnosis, so if you're experiencing symptoms, don't delay in seeking medical attention. Early detection is key, so being aware of these symptoms and getting regular checkups can make a huge difference. After all, knowledge is power, and recognizing these symptoms early on can provide the best chance for successful treatment. Scene script. Acute lymphoblastic leukemia might sound scary, but there are treatments available. With this in mind, let's delve into the treatment options that are currently present for this condition. First up is chemotherapy, which is the main form of treatment for acute lymphoblastic leukemia. This involves the use of drugs to kill cancer cells or stop them from growing. Chemotherapy is often given in cycles over a period of time, allowing the body to recover between treatments. However, it's worth noting that like all treatments, chemotherapy comes with its own set of side effects, including fatigue, nausea, and hair loss. Next, we have radiation therapy. This treatment uses high-energy radiation to kill cancer cells or keep them from growing. It can be used alone or in combination with other treatments. While effective, radiation therapy can also have side effects, which may include skin changes, fatigue, and nausea. For some patients, targeted therapy may be an option. These are drugs or other substances that specifically target and block the growth of cancer cells while causing minimal harm to normal cells. This treatment approach is often used in combination with other therapies to increase their effectiveness. Finally, in more severe cases, a stem cell transplant might be considered. This procedure replaces the patient's unhealthy bone marrow with healthy stem cells from a donor. While a stem cell transplant can be a curative treatment, it's a complex procedure that carries significant risks and requires a lengthy recovery period. The choice of treatment for acute lymphoblastic leukemia depends on a number of factors, including the patient's age, overall health, and the specific characteristics of the leukemia. Therefore, it's crucial to have a thorough discussion with your healthcare provider about the best treatment plan for you. It's important to remember that while these treatments can be tough and come with side effects, they offer a chance to control the disease and in many cases even cure it. Medical science has made tremendous strides in this field and continues to do so with ongoing research and clinical trials. While the journey may be tough, with the right treatment and support, there is hope. But what does living with acute lymphoblastic leukemia look like? When faced with a diagnosis like acute lymphoblastic leukemia, or ALL, life can shift dramatically. The journey ahead can be challenging, but it's important to remember that you are not alone. Living with ALL often means adapting to a new normal. There are medical appointments to attend, treatments to undergo, and side effects to manage. These changes can be overwhelming, but they're a crucial part of the journey towards recovery. Your mental health plays a significant role in this journey. It's natural to experience a whirlwind of emotions: fear, anger, sadness. These feelings are valid and important to acknowledge. It's okay to seek help. Engaging with a mental health professional can provide you with strategies to cope, to build resilience, and to navigate this new terrain with strength and positivity. Support from loved ones is invaluable. They can provide a listening ear, a comforting presence, or practical help. They're there to share your victories, no matter how small, and to hold your hand during the tough times. So don't hesitate to lean on them, to share your fears and your hopes. This journey is not one you have to walk alone. Following your doctor's instructions is another key aspect. They will guide you through your treatment plan, answer your questions, and help manage any side effects. Remember, they are part of your team, working towards the same goal: your health and well-being. Speaking of side effects, it's important to remember that everyone's experience with ALL is different. Some might have minimal side effects, while others might find them more challenging. Tips like maintaining a healthy diet, staying hydrated, and getting regular gentle exercise can help manage these side effects. Living with acute lymphoblastic leukemia is not easy, but with resilience, strength, and a good support system, it is manageable. Remember, you are not alone in this journey.